Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Today we're going to talk a little bit about hormone replacement therapy. This week a couple people were out with the flu, so I got to actually see some patients this week. I had some kind of cool stories. And we're also going to talk about regenerative medicine and how healing actually occurs in the body. I want to clear up some misconceptions about that. So we're going to cut the break and we're going to tell you how you heal and talk about hormones.
Okay. Ready to roll?
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is a website. Check out the site. We have a lot of cool stuff on there, the old radio shows. But anyways, I want to talk today a little bit about some of the stuff. I actually got to step into practice a little bit this week. We had some staff out with the flu. So I got to see some patients. I was actually consulting with another office in Youngstown, Ohio yesterday. And I got to see some patients. And one patient in particular really struck me. A lady came in. She was probably, I want to say she was 47 years old. And before I sit down with anyone, I just want to really, just like everyone does at Buckeye, find out what's really wrong with the person. And kind of a unique thing at Buckeye, whether at any of our offices, is you're not rushed. When you come to our office, we're spending a half hour to 45 minutes with every new patient and really talking with you and figuring out how long you've had your problem and what things have you tried that haven't worked out. We don't rush our patients. So this lady came in, and just like every other patient, I said, before you sit down, tell me what your problem is. And she went on. She had everything. She had headaches. She had upper back pain. She had lower back pain. She had plantar fasciitis. She had knee pain. She had bladder surgery that didn't heal. She's just going on and on and on. And she's like, really, what I'm here for? I wish you guys could do a body transplant. She really said that, and I'm thinking to myself, this poor lady, and she just got back. She went to the podiatrist and bought a $700 foot brace for her plantar fasciitis, and she got a back brace at her orthopedist, and she was on some type of medication because she had psoriatic arthritis to help her with the psoriasis, and she's on all this different stuff, and I'm like, how's that going for you? And she's like, none of it's working. And she had blood work done at the rheumatologist. The blood work was $800. To tell her that her insurance company wouldn't cover the medication that would help her, which probably wouldn't have helped her anyways. And this lady was at her last string, and the first thing I asked her is like, how have you been through menopause yet? And she had a hysterectomy 4 years ago, and I asked her, when did your health problems begin? And she's like, honestly, I started falling apart right after that occurred. And then it struck me, this poor lady here, she's been on all these medications, surgeries, braces, all that. It just doesn't matter if she doesn't have her hormones. And when a woman goes through menopause, that's what menopause is. You don't, you lose your estrogen, your testosterone, your progesterone, growth hormone, DHEAS. No matter what bracing or, she's seeing a chiropractor. It doesn't matter what kind of chiropractic, physical therapy, bracing, pain medication she takes. She's never going to get better if she doesn't get her hormones balanced out. Never, never, never. And I said, I can refer you to the chiropractor here. I can have you see the physical therapist for your knee. We can show you some stretches, but you know what? None of that's going to work if we don't do blood work on you and see what's going on hormonally with you. Because if you're ahormonal, if you've been through menopause, and we don't address that, nothing's going to last. And I didn't want to waste her time and have her come for a bunch of visits she didn't need. That's what she needed. And how many other people out there listening to this show are doing the same thing? They go to the physical therapist all the time, or chiropractor all the time, or the medical doctor, or they're taking pain medications all the time. None of that works if you don't have hormones. None of it. And if you're suffering with pain, or you're not recovering, or you feel like, it's one injury after the next injury, or you have a chronic injury that keeps coming back, step one is get your blood work done. Check your hormones. Your hormonal system, the way it works is it controls your remodeling system. So basically what that means is, the way you can think of the way your body works is every single day your body is rejuvenating and regenerating tissue. Your skin replaces itself, your hair replaces itself, your cartilage replaces itself. Everything's always rejuvenating and regenerating. But that whole system of rejuvenation, or remodeling we call it, that's the proper terminology, is run by your hormonal system. So if you don't have hormones, which what happened to males and females as they get older, you don't have remodeling. So if you don't have remodeling, you don't heal. It doesn't matter what you do. It doesn't matter what kind of PT, chiropractic, medical procedures, even the stem cells and PRP procedures we do. if someone doesn't have hormones and we do an allograft or stem cell procedure or PRP procedure, it just doesn't matter. It's not going to last. So even with those patients, if you're not a healthy host, nothing works. So and some things that actually make it worse too is a lot of people who suffer with chronic pain will take opioids. If you're taking opioids or Xanax, which is another thing people with a lot of pain take, that further reduces your hormonal system. That makes it worse. So even more reason to take hormones. So so if you're sitting there listening and you're taking Percocet or Vicodin or Oxycontin for your chronic back pain or knee pain or whatever type of pain you have, you're making the situation worse. You're not helping yourself at all. You're making it worse. And when people have aches and pains, you have to make a decision. Do you want to fix it, or do you want to mask it? There's a huge difference there. Think about this. Do you want to fix it, or do you want to mask it? So if you're driving to work and your check engine light comes on, you have a choice. You could ignore it. If you're OCD, you can put some tape over it so no one else sees it. Or you can go to the mechanic. When you take a pain medication, whether it's an NSAID like a Tylenol, Aleve, Advil, or a muscle relaxer, a Soma or Flexeril, or cortisone, or corticosteroid, or an opioid, you're doing nothing. Let me repeat this. You're doing nothing to fix your problem. There's no healing properties in any of those. And if anything, you're doing more harm. We know NSAIDs, which are, Advil, aspirin, these over-the-counter medications, these kill stem cells. And you don't have to go to a doctor to get stem cells. You don't have to come to Buckeye to get stem cells. You have your own stem cells. If you didn't have stem cells, you wouldn't be alive. You'd live for a couple days and you'd be dead. So we all have stem cells. So what's happening is when we have areas that are degenerating, we don't have enough stem cells there, or we don't have a hormonal system to back them up. We're not a healthy host. And when you take an NSAID or an opioid, or worse yet, put cortisone there. Get a cortisone injection in your back, your shoulder, your elbow. It kills everything in the joint for 6 weeks. Everything. And on top of it, it stops what we call osteoblastic activity. And osteoblastic activity is, once again, your muscles, your bones, your cartilage are always rebuilding. That's done by these osteoblasts. When you inject cortisone into anywhere, it kills and stops all osteoblastic activity. So for the next 6 weeks at least, there is no rebuilding or remodeling in that joint. I don't care where it's at. And that's any corticosteroid. A lot of times I'll ask patients, did you get a cortisone injection? No, I didn't get that. I got some other type of steroid. If it's a corticosteroid, it's cortisone. And it's killing the joint. Literally killing it. Think about it. If you're only allowed to get 3 cortisone injections per year per joint, is it because it's good for you or because it's bad? It's bad because every single injection causes up to 8% bone degeneration, ligament and tendon degeneration. Any more than 3 per year per joint would be medical malpractice. That's why they don't do it. So if you're sitting here and you're listening and you're getting cortisone injections, you are speeding up the process. You might as well just sign up for surgery. Just sign up. Just go sign up for it because that's what you're doing. So I'm going to cut the break, and then we're going to come back and we're going to talk about how to do body transplants. Not really, but an alternative to that. And a little bit about regenerative medicine. This is Dr. Buzz with Buckeye Physical Medicine and Rehab, BuckeyePMR.com.
All right. Body transplant. Wow, wouldn't that be cool? Maybe one day. Ready?
Definitely. Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab, BuckeyePMR.com. .com is the website. Check it out. And we were talking a little bit about the importance of hormones and how when you're suffering with pain, how you have to make a decision. Now, I want to clarify something. If you roll your ankle, if you have a headache, I have no problem with you taking an NSAID, which is those Aleve, Advil, Excedrin. So for short-term use, they're fine. Just as the label says, if you read the back of the label on these medications, for up to 10 days, they're fine. After 10 days, it makes no sense to continue taking these. And it's also not safe. Just because something's over-the-counter, we're talking about Aleve, Tylenol, Advil, any of these over-the-counter medications, it doesn't mean you can take them on a daily basis for the rest of your life. Last year alone, the FDA estimated that 20,000 people died in the United States from taking NSAIDs for long-term use. That makes taking NSAIDs the 16th leading cause of death in the United States. So just because it's over the, yeah, you heard me right, the 16th leading cause of death is taking NSAIDs in the United States, according to the FDA. So the point being, just because it's over the counter doesn't mean it's safe. Okay? So, and there are alternatives out there, as we talked about. The body does heal. If you're alive, you heal. You know, if you have any doubt about that, you know, think about it. If you get cut, does it heal? Of course. If you're alive. If you're dead, it probably doesn't work out for it. But anyways, so if you're alive, you have the ability to heal. But what happens is, and the reason we have the ability to heal is because we have hormones and because we have stem cells. Now, obviously, as we get older, everyone heals slower. And the reason we heal slower is because we have less hormones and we have less stem cells. Okay, but we still heal. Up until the point you die, you still heal. But what happens in particular, as we get older, stem cells in particular, the way stem cells work, whether you get cut or whether you have a joint injury, is pretty amazing. So you have an area that's injured, and when an area is injured, the cells are damaged. And when the cells are damaged, there's usually inflammation. And the cells also in that area that are damaged call for help. And the way they call for help is through this process called paracrine signaling. So when you have an injury, whether it's a cut or a joint injury, you have these damaged cells, and they call out for help through this paracrine signaling. And that paracrine signal attracts your own stem cells. We have stem cells that attracts your own stem cells to the area of injury, whether it's a cut or a joint injury. When the stem cells get to that area, the stem cells, and the ones we're talking about today are mesenchymal stem cells, which are tissue stem cells. That's what causes, heals injuries. Those mesenchymal stem cells attach to local vasculature. And when they attach to local vasculature, we change the name from a mesenchymal stem cell to a periocyte. It's the same cell, but once it attaches, it becomes this periocyte. And once it attaches to the periocyte, that releases growth factors that feed your dying cells and bring them back to life. That's how healing occurs. So you have an injury. The injured cell calls for help through paracrine signaling. Your own stem cells are attracted to the area. Once they are attracted to the area, they attach to local vasculature, and they, at that point, become this thing called a periocyte. The periocyte releases growth factors, and when it releases growth factors, it feeds your dying cells and brings them back to life. So many people are out there, and they've been told they have degenerative joint disease. And people, when they come to the office, they have degenerative joint disease. I think they think it's like a diagnosis, like cancer. Like, I have this, there's nothing I can do about it. This disease I caught or whatever, and I just have it. My dad had it too, so I guess I'm going to have to live with it. And eventually I'm going to have my joint replaced, or eventually I'm going to have my back fused. Doctor told me for sure, we're just trying to wait. So I'm taking these pain pills to mask it in the meantime. Degenerative joint disease is simply this. Your cells in that area are dying quicker than they're being reproduced. That's what degeneration is. The cells are dying quicker than they're being reproduced. And the one thing we do know about degeneration, if you don't do anything about any type of degenerative condition in your body, it always gets worse. An example is a cavity. If you have a cavity and don't do anything about it, you have degenerative dental disease, it gets worse. The same thing happens with your joints. So now you got to make a choice. You've been diagnosed with this degenerative joint disease. Do you try to fix it, or do we do traditional medicine and mask it? So what traditional medicine do is you go to your doctor, you have, he takes an x-ray of your knee or your back. Oh, you got degenerative joint disease. We're going to give you a cortisone injection is typically what they'll give you. And what they're doing is they're injecting this corticosteroid in there that kills everything in the joint for the next 6 weeks. So you're speeding up the degenerative process. So think about this. You have cells that are dying quicker than they're being reproduced. Why would you put a substance in there that's going to kill everything for 6 weeks? It makes no sense. So maybe you don't opt for the cortisone injection because you don't like needles or whatever. You've had one before and they sting. So you can take over-the-counter medications or get some, say it's really bad, you get some opioids or some type of pain medication. Once again, nothing in that helps heal the joint. You're masking what's going on. And worse yet, it's kind of like when your check engine light comes on. When it comes on, usually if it's, you would probably, and it may say the engine makes a noise, you probably drive the car a little more gently because you don't want to mess it up until you get the mechanic, right? When you take these pain medications, it does shut the pain's there to warn you something's wrong, right? That's why your joint hurts. When you take a pain medication, you're shutting down those pain receptors. You end up doing stuff you shouldn't be doing, once again accelerating the whole process. Doesn't make a whole lot of sense, okay? So but that's traditional medicine, and pretty much traditional medicine is waiting, until you have surgery. So the alternative to that is using regenerative medicine. Now, regenerative medicine is a newer branch of medicine that focuses on getting the body to heal itself. And if you're alive, you qualify for regenerative medicine. If you're still alive, you have stem cells, you have the ability to heal. Okay? So anyone can heal. I don't care if you're 40, 50, 60, 70, 80, 90 years old. We have patients that are 90. They come in, they do regenerative medicine. It doesn't, your age is age independent. Okay? What does regenerative medicine encompass? Well, there's a few things you got to look at. Number one, you know what I'm going to say, hormones. If you don't have hormones, you can't fight inflammation, you can't have osteoblastic activity, you can't regenerate anything. So step one is get your hormones checked out. If your hormones are balanced out, another thing that's very important is nitric acid levels. Nitric acid is produced in your body in the endothelium, which is inside your arteries and veins. And what it does, number one, is it makes sure your blood vessels stay open. Circulation and oxidation, getting blood and oxygen to areas of injury, is essential. If you don't have good circulation, that's where stuff degenerates first. And if you think about it, that's logical. When people get older, what happens? They have degenerative discs, degenerative knees, degenerative hips. You never hear when someone has back pain, it's not because their back muscles are worn out, it's because the disc is worn out. Well, the muscle's got good vascular supply. So the muscle, although it has a lot of wear and tear on it, because of the circulation, stem cells are able to get there, and those stem cells have oxygen so they can do their job. Because if stem cells don't have oxygen, they don't release their growth factors. Okay? But the disc in your low back has terrible circulation. So stem cells may get there when you have a herniation or disc injury, but because of the lack of circulation, they can't release their growth factors. There's no healing going on. So what's the solution to this? Well, some of the things we use at Buckeye that improve circulation is hormones improve circulation. This nitric acid we just talked about improves circulation. And it's a simple test we do in the office. And if you're deficient, we recommend you take a nitric acid supplement. It's very inexpensive and easy to do. That makes you a healthier host. And if you really want to get some circulation to joints, and we're talking about the hard joints, knees, shoulders, hips, discs in your back, you need to do other types of therapies. A couple of things we do that are pretty cool. One of them is called shockwave therapy. And shockwave therapy, I don't want to confuse that with ultrasound therapy. They're totally different. Shockwave therapy is the same technology they use for kidney stones. When people have kidney stones and they're bad, they use high pressure sound waves that are really strong, that can literally penetrate through your body, go to the kidney, and break up the kidney stones. So you can imagine much more strong than an ultrasound if you read an ultrasound. That same technology, if you use it on a joint or on a deep muscle, opens up blood vessels and causes new blood vessel formation. So that's how shockwave therapy works. Very, very, very effective. For plantar fasciitis, over 95% effective. If anyone has plantar fasciitis and they're listening to this show, come to Buckeye. 3 treatments, your plantar fasciitis is fixed. Guaranteed every single time. Very effective on lots of other things too, but that's just one example. A lot of people suffer with plantar fasciitis, and they get braces and all. None of that stuff works. And worse yet, then you'll do cortisone injection into plantar fasciitis, which number one hurts like crazy. A big needle in your foot. But what's that going to do? It's going to weaken the tendon, and if you weaken the tendon, you're more likely to tear your Achilles tendon. Masking the problem doesn't make a lot of sense. Once again, you're dealing with a circulatory problem in the plantar fascia. As you get older, obviously circulation to the extremity is worse. That's why people have erectile dysfunction and plantar fasciitis in the extremities. This shockwave therapy improves both. Another technology we have at Buckeye is a hot laser, a high-powered hot laser. The laser we have is a 60-watt laser. I always tell people, people will say, well, I've been somewhere else and they had a laser. If you don't feel the laser, it's not going to work for deep tissue. So if you don't feel it, if someone's putting a laser on you and you don't feel it, it's for superficial only. To get to deep tissue, it has to be a hot laser, and you're going to feel it. It's going to feel warm. Almost feels like a blow dryer. But that, through photobiosynthesis, opens up blood vessels and increases cell metabolism, thus allowing, once again, getting your own stem cells to fix the area. Once again, we keep circling back. The best way to heal yourself is get the body to heal itself. Surgery will never match what your body can do. God was way smarter than any surgeon. You got to get your body to heal itself, and you got to open up and get circulation and remove scar tissue, and that's what shockwave does, and that's what a high-powered laser does. A laser you can actually feel will reach in there to the disc, to the knee joint, and actually open it up. And then the final technology we use, and this is actually an older technology, but a lot of it's done in Europe. Pretty much every NFL training room at this time is going to be using it, is ozone therapy. I know what you're thinking, ozone, what the heck's ozone going to do? Well, ozone, which is O3, oxygen's O2. So oxygen's an electron molecule with 2 oxygen molecules. Oxygen's very stable. O3 is an electron molecule with 3 oxygens on it. Very unstable, okay? And that instability or instability is what is needed to get oxidation to a joint and get a joint to release its growth factors. So once again, we'll talk about this a little bit. The areas you have typically that don't heal are areas with poor circulation. What has poor circulation? Joints. Knees, hips, discs in your back. And the reason they don't heal isn't because of what they are, it's because of the poor circulation there. Your body cannot get stem cells there, and when it gets stem cells there, if there's no oxygen, the stem cells don't do anything. They just hang out. They're not activated. You got to activate your own stem cells. When you inject ozone, which is an unstable molecule, into there, that third oxygen molecule literally jumps off. And when it jumps off, it oxidizes the area and gets your own stem cells to release their growth factors, thus healing it. Very effective. And we've been doing this for, like I said, in Europe for a long time. Hyperbaric chambers work very similarly. Everyone, or more people know about hyperbaric than do about ozone therapy or prolozone therapy. If you mention hyperbaric, everyone's like, "Oh yeah, I know that's really good for you." Yeah, and it is good for you because going in a hyperbaric chamber is the same thing. You go there, it basically forces a higher concentration of oxygen into your body, and thus will speed up healing. My mom's boyfriend had bladder cancer. His bladder wasn't healing, so he went. The VA has a hyperbaric chamber. They put him in the hyperbaric chamber for 6 or 7 sessions, and his bladder healed up. Well, that's very logical. The oxygen was able to get to his bladder, which has poor oxygenation, and that healed the injury. He got his own stem cells to heal his bladder. But even better than that is using ozone in a joint, because instead of sitting in the hyperbaric chamber for a half hour or an hour, whatever they do, we can simply inject you with a very small gauge needle, put the oxygen right where we need it, and cause an immediate result. Immediate. And this is the stuff we're doing at Buckeye. So if you're sitting listening and you have chronic pain or chronic injuries, step 1, get your hormones tested, because it doesn't matter what type of therapy you do, it won't last if you're ahormonal. Step 2, nitric acid levels. Make sure those are okay. Why is that important? Once again, if you're deficient in nitric acid, your arteries and veins will be constricted. Another sign of that is you'll probably have high blood pressure too. If you're deficient in nitric acid, you restore that, which is very simple. It's a supplement you take. You increase circulation, and all of a sudden, you don't have the high blood pressure, the erectile dysfunction's fixed, and guess what? You also heal. And step 3, if you've done all those things, and you still have an area that's not healing, if you're alive, we know you have stem cells, what can we do to get your stem cells to work? And the answer is simple. Shockwave, ozone, and laser. These are 3 modalities that we have at Buckeye, and used, as an individual therapy, they work great, but when you use them in conjunction, the results are amazing. And if you are the worst of the worst, and maybe you need more stem cells there because you're bone on bone, then we do tissue allografts. And that tissue allograft has growth factors and stem cells in it to add to what you have to heal. So we supercharge that healing process. And we do that, and we also do it with PRP, which is platelet-rich plasma, which is simply growth factors too. But PRP or tissue allografts or stem cells don't work if you don't do the other therapies with it. And unfortunately, there's some people around the country that are offering, PRP therapy and stem cell therapies. If they're not treating the joint and oxidizing that joint and doing laser or shockwave or ozone, or better yet, all 3 of those, it doesn't matter because you're putting live stem cells in an area with no circulation. They won't do anything. So, and that's what we offer at Buckeye. Obviously, we can't help everyone, but I am very proud to say that our success rate on people with degenerative conditions, and we only get the worst of the worst, is over 90%. So I strongly recommend, if you're listening to the radio show and you have something that you're suffering with and been told you're going to have surgery, you'll never get better, this degenerative condition, sooner or later you're going to have surgery, mention the radio show, come in. There's no charge for us to sit down with you, evaluate you. We don't do body transplants, but we do close to it, and see if we can help. This is Dr. Buzz with Buckeye Physical Medicine Rehab. BuckeyePMR.com is the website. Until next time.